I am a psychiatric nurse practitioner in private practice in Salem.
Please continue.
And I am in support of this bill. I can tell you that our psychiatric nurse practitioners saw the very same patients that the psychiatrists did. And I was pleased to see the psych nurse practitioner sometimes consulting with a physician and the physician sometimes consulting with a psych nurse practitioner.
Co-Chair Schaffler, Co-Chair Kennemer, and members of the committee, thank you for the opportunity to testify in support of House Bill 3401. My name is Anna Stiefvater. I'm a public health nurse, and I'm here today to testify on behalf of the Oregon Nurses Association. The Oregon Nurses Association cares about this bill and supports this bill because policies that help working families balance their the needs of their families and their responsibilities at work will improve the health of Oregonians.
Linda Enos, nursing practice consultant, occupational health nurse, Oregon Nurses Association, Co-Chair Thompson, Greenlick, and members of the committee. Thank you for allowing us to testify today. The Oregon Nurses Association supports House Bill 3229 that strengthens reporting in physical injuries that occur as results of acts of violence that are directed towards healthcare staff. As we've just heard, and in my testimony provided, there's many statistics about this increasing issue in the U.S. in healthcare. We know that healthcare workers are 3 times more likely to be injured in healthcare as a result of physical violence than any other worker in any other industry.
My name is Susan Walters. I've been an emergency nurse for over 35 years. Nurses are grabbed, kicked, spit on, punched, and bitten so often it has become a challenge to retain quality caregivers. Each time a healthcare worker is not able to protect themselves or the patient effectively during an outburst, they become less confident about their ability to be safe and effective in future incidents. Often they decide to transfer to other areas of the hospital or leave healthcare entirely at a time when we need to retain skilled nurses to ensure quality care.
Chair Beyer and members of the committee, thank you for the opportunity to testify in support of House Bill 2092 and the -2 amendment. For the record, my name is Teresa Russell, and I'm a nurse practitioner in Enterprise, Oregon. I have my own clinic, Olive Branch Family Health Incorporated. It's new. We've been open 6 months. I have electronic health records, and they tell me that I have about 700 patients in my practice now. So you can see nurse practitioners in rural communities do serve the community and are needed. Limiting the time that a nurse practitioner can treat a workers' comp patient, in addition to interrupting that continuity of care, can pose a significant challenge for the patient who has to see a physician out of the county or somewhere else. The travel, it's very difficult. So I have a lot I can say. I want to thank you for letting me testify, and I urge you to support House Bill 2092 with the -2 amendment.
I am a public health nurse by vocation. As you've heard, bisphenol A is a hormone-disrupting toxicant found in plastic products and the lining of canned food. It leaches out of the plastic or the can lining into food and liquids that we put into our bodies.
My name is Melissa Sanchez, and I am a board-certified family nurse practitioner. I currently practice at Willamette Family Medical Center here in Salem, and I am an active member of the Oregon Nurses Association. I'm here to tell you today why I support this bill as a nurse practitioner and as a mother of a young 7-month-old. I care for a population that is 60% covered by an Oregon health plan, and 30% of my patients have no insurance at all. Almost all of my patients with children utilize WIC services, and I believe that it is essential that WIC formulas and products that they supply contain no BPA. When this bill passes, hopefully, it will improve the health of the most at-risk population and help make safe products available to Oregon consumers, including my patients. My name is Anna Stiefvater. I care about this bill because I'm a public health nurse, a member of the Health Policy Cabinet for the Oregon Nurses Association, and a mom. I work with pregnant women and young children, many of whom are low income.
The families I see are more likely to be in poor health, more likely to have children at risk for poor developmental outcomes, and less likely to know about the warnings around BPA or follow guidelines for the safe use of plastics. They don't have the time to track down the latest information on safe products. They're using borrowed bottles and sippy cups because that's what they can afford. This BPA ban is important because it will protect Oregon's children regardless of income. It will ensure parents don't have to worry every time their young children eat. I urge you to support Senate Bill 695. Thank you for your time.
Co-chairs Greenlick and Thompson and members of the committee. My name is Lairleen Dunsmuir, and I'm a family nurse practitioner practicing at one of the Providence Immediate Care Clinics. I'm here today representing the Oregon Nurse Association and the Nurse Practitioners of Oregon and presenting testimony in favor of House Bill 2386 with the -1 amendment, which would remove dispensing restrictions for NPs. We're all interested in providing the best quality, affordable health care, and we know that we need to think outside the box and do things differently to meet the needs of the many patients seeking our help.
Good afternoon, Chairman Anderson and members of the Senate Healthcare, Human Services, and Rural Health Policy Committee. Thank you for the opportunity to testify in support of Senate Bill 858. My name is Mary Grant. I am an adult nurse practitioner and chair of the Nurse Practitioners of Oregon. Is that here in the state of Oregon has historically valued NPs as healthcare providers, and current state and federal reforms continue to emphasize the role of the NPs play as we transition to a system that will incentivize primary and preventative health care, seek to improve population health, and limit overall costs. While NPs in Oregon have a very broad scope of practice and have earned the right to practice independently, our reimbursement from insurers for services provided continues to be inadequate and quite discriminatory.
I'm also a member of the Oregon Nurses Association and the OWEB Board of Directors, and was the founding CEO of Care Oregon, ultimately passing the tobacco tax increase of at least $1 a pack and dedicating some of the additional revenue to tobacco prevention and cessation services to help these low-income Oregonians and all of us can begin to narrow the mortality gap between lower and higher income Oregonians